It's been almost 1 year since the COVID-19 made its way to the U.S., and our lives, our children's lives, have been affected by all of the changes. As a result, mental health professionals are seeing different emerging behaviors in kids. Here to explain the behaviors and how parents can help is licensed professional counselor Susan Harrington. Good morning, Susan. This is taking a toll we're seeing on children. In what ways?
It is, John, and thank you for having me on this morning. So, when I was asked to do this, I polled out the community therapists. So we're talking about in our community what we're seeing. We're seeing a number of different things that are very concerning. They start off with just some adjustment concerns, but they can extend out to self-harm and as well as suicidal ideation, which is really scary. So the things I want to impart that we can look at and find now in our children to look for are things like a change in their confidence level, a change in their concentration, their struggle with virtual learning, social interaction, and that's decreasing, as well as anxiety and overwhelm, depression, and their mood shuts down. They might be more angry than usual, some difficulty sleeping, their appetite is changed, their physical activity level, we were just talking about just kind of sitting on the couch and shutting down, that sort of thing. And also there's a breakdown in the family structure and the routine. Now the most regretful one that we're seeing is some kind of way our teens are having an increased use in substance abuse. So we need to be very mindful of where those things are in our home as adults.
So, obviously this varies by child, it varies by their situation, it varies by age group, but in a general sense, what can parents do?
Now that's really important. As parents and as adults, we need to be really mindful to implement some things in our lives. So one of them is that daily routine and structure. It is primary. After Katrina, we talked about how routine and normalcy was not there. The more that we can keep our routine in place, wake up at the same time, do the same activities, go to bed at the same time, do the same activities, the better it is for all of us in our mental health. The second is, the one that's probably most challenging, is to limit the use of electronic toys. What that does is it's a breeding ground for that anxiety, that isolation, that depression, those things. So limit the time on electronic toys.
But you have to kind of be creative, I assume, about how you go about, getting some change to their isolation.
You do have to be really creative. So we have our nuclear bubble, which is the people that we live in the house with. We also have our extended bubble. So there might be people that you trust, that you know how they're behaving and what they're doing, and that on a regular basis you're interacting with each other. Allowing the children to have outdoor play dates with them is an example of how to make that happen.
Susan, we're almost out of time here, unfortunately, but how does a parent know that, okay, this isn't just something that is manageable here in the home, that we need some professional help?
Right. So if we see things like those major changes, you see things that concern you with suicide and things like that, or there's some drastic changes, then you need to go to your pediatrician, get a 24-hour appointment. You need to go to the emergency room pretty quickly. However, if the routine and structure that you've put in place after a week or two and there's no change in their moods, at that point it's really important to contact someone who specializes in play therapy or teens and family therapy.
All right, Susan Harrington, thank you very much for your thoughts on kids and how to help them through the pandemic, maybe in some ways that we're not always as aware of as we go about our lives. Appreciate it.
You're welcome. Thank you.
Time now is 8:17. Let's go to Shelby.